Millions sickened with the flu. As virus activity picks up across the U.S., the flu continues to spread across the U.S., with elevated activity in nearly every state. On Friday, the Centers for Disease Control and Prevention reported widespread flu in 30 states, mostly on the West Coast, along the southern border, and in the mid-Atlantic states. The CDC estimates there have been at least 3.7 million flu cases so far this season, 32,000 of which required hospitalization. Nearly 2,000 people have died, including 19 children. 4 antiviral medications are available, including Tamiflu and Exofluza. All have been shown to be effective against 99% of flu viruses tested. Most people getting sick are infected with a strain called B. Victoria, which usually doesn't pop up until the end of flu season. Those viruses tend to strike children and young adults more often, but anyone can be affected. In general, B strains are less likely than A strains to cause severe infections. There's also evidence now that A strains are increasing. New research offers insight into why some flu strains affect certain age groups more severely. It depends, in part, on what strain of the flu a person first caught as a child. Researchers analyzed health records from flu cases over time, and found the body's immune system remembers its first bout with the virus, building a lasting and strong defense against it. The phenomenon is called immunological imprinting. The problem is, the body only remembers how to fight off that particular viral strain of the flu. That means the immune system's defenses aren't as strong against other strains. In other words, if you were a child and had your first bout of flu in 1955, when the H1N1 but not H3N2 virus was circulating, an infection with H3N2 was much more likely to land you in the hospital than an infection with H1N1 last year, author Michael Worobey said in a statement. Worobey heads the Department of Ecology and Evolutionary Biology at the University of Arizona. Our immune system seems to be locked into fighting just one half of flu genetic diversity, Worobey said. We need to find ways of breaking that. The study was published Thursday in PLOS Pathogens.